สู่ช่วง Med in Focus กันแล้วนะคะแต่อยากจะมาบอก metster กันนะคะเพราะว่าวันนี้เนี่ยเป็นท็อปิกที่น่าสนใจแล้วก็เป็นท็อปิกที่ใกล้ตัวมากๆเดี๋ยววันนี้เราจะมาไลฟ์กันเป็นภาษาอังกฤษกันนะคะเป็นท็อปิกเกี่ยวกับการมีบุตรยากนะคะวิธีการ overcome Infertility นั่นเองนะคะว่าทำยังไงการมีบุตรยากเนี่ยมันมีปัจจัยอะไรบ้างนะคะซึ่งวันนี้นะคะเราจะอยู่กับดร.ประภากรมิ่งมิตรพัฒนกุลนะคะคุณหมอเนี่ยเป็น Obstetrics Gynaecology and Reproductive Medicine from Bangkok Hospital นั่นเองค่ะซึ่งเดี๋ยววันนี้คุณหมอมามอบความรู้นะคะแล้วก็คุณหมอก็จะมีวัคซีนนะคะเป็น Reproductive Influenza วัคซีน1ช็อตด้วยดังนั้นแล้วนะคะกดไลค์กดแชร์ไลฟ์ Facebook ตอนนี้เลยค่ะ
Met in Focus
Medsters, we're back in Met in Focus. Today we are going to be talking about infertility under the topic of overcome infertility. Of course, this is a massive problem that has been happening these days, and today we are with Dr.Papakorn, Mingmitpattanakul. He is the Obstetrics, Gynaecology and Reproductive Medicine for Bangkok Hospital, and he will be educating us about infertility. Nowadays, the need of having babies is increasing, and of course it comes with problem, and we are here with Dr. Papakorn. สวัสดีค่ะ
สวัสดีครับ
สวัสดีค่ะ Doctor. Today we are going to be talking about a very hot topic that is, I believe, happening. It started very early with a lot of people as well with infertility. A lot of people are experiencing infertility and find it very, very difficult to have babies nowadays. Now, we would like to get to know more about infertility.
Yes, today because of the couples, they start a family quite later than before, right?
Right.
So normally, the couples, when they try to have a baby for about 1 year and they cannot be successful, we call that infertility problem. But right now, they start the family maybe sometime later than 35 years old,
right,
for the woman. So sometimes we reduce the time to maybe only 10 months, 8 months. And sometimes when they go to 40 years old,
right,
only 6 months cannot be success. We will start trying to help them. So that's the point of infertility. So this is the first part, that how can we know that this is an infertility problem.
Right. Okay. So it's about a year for younger people, and people that are a little bit older, if you've been trying for 6 months and it's not success, that means you have infertility problems.
Yes, that's right. And more than that, we have to think about, because sometimes they work in different places.
Right.
So we may count the time that they stay together and they try. You see, sometimes they married for 1 year, but they just try only 4 months, for example.
Right. Right. So with a lot of problems going on about infertility right now, it's not just with older people, but it's also with younger people. What are the costs of infertility?
Okay, I'm sorry to say most of the problem is come from the woman more than the man.
Yes, so I've been told.
Yes.
Now, why
okay.
is that?
So for the women, we have the problem about the womb, the fallopian tube, and the ovaries.
Right.
But for the man, it's just a sperm. So it's quite easy for the man, just come and check the sperm test, that's all.
Right, right.
But for the woman, we have to talk about, okay, how about your periods? It's come regularly, so this is about the eggs.
Mm-hmm.
And we have to ask about the periods, how much the bleeding come to see that the womb is okay or not, and is ready for implantation of the baby after fertilization or not.
Right.
So for the woman, we have to check many things. Like we check ultrasound to see the womb, to see the ovaries. We have some blood tests to tell the function, like the hormone, something like that. But the man, easy. Come and check sperm test, that's all.
That's basically it for men. But for women, we have to check the fallopian tube damages, blockage, your ovaries, and everything.
Yes.
What are the number one cause that you've experienced with patients walking in?
Yeah, for example, you can see in the picture,
Right.
The ovaries fall down once a month and go into the fallopian tube, but some women, they have problem with their hormonal balance in her body. So she cannot have the ovulation normally. So when just only sperm, no eggs, it cannot be fertilized, right?
Of course.
And then when the eggs go into the fallopian tube, sometimes the women may got the infection in the past, and it can cause a blockage of the fallopian tube. So the egg cannot go back to the womb, so the pregnancy cannot happen.
Right.
The third one, when the embryos come back after fertilization, they come back. The woman got some fibroid or some polyps inside the womb, so the implantation cannot happen. So for the starting, and the doctor, I will check all of this to see that is there any problem and how can we do, or sometimes we need some surgery to help. We need some medication to help. Yes.
Right. So it does help. Does it have to do with lifestyle that you use since you were young?
Yes, the lifestyle is usually related to the ovulation thing mostly, because some stress it make the ovulation cannot go on regularly. So we have some medication to stimulate the eggs to fall down, and we have some some medication and change some lifestyle to make the eggs fall down easily. And one more thing, when the egg fall down, it can stay only 24 hours waiting for fertilization. That's a very important part. Because if the ovulation happened today, but you have a sexual relation 2 days later,
Right.
nothing happened.
Right. So basically, it's also like having a kid is also like a jackpot, that it has to be a certain time, certain day, and certain hours.
Yes, but anyway, for the sexual relation, when you have it, and the sperm can stay about 2 days inside the woman womb. So in the new married couple, if they have a relation about 2 or 3 times a week, so they don't have to count the time.
Oh, right.
They don't to fix the time. They just have a natural way, so it's easy. But when the couple start later, like at 35, 40 years old, the regularity of sexual relation may be less than that. So we must help.
Right, that's right. So how are we going to determine the cause of infertility?
Yes, so as I said, we start with ultrasound, some blood tests, and this is it's an easy step, but the next step is to check the fallopian tube is more complicated. We have to do some injection the dye into the womb, so it's sometimes more painful. So we will select only the case that need it.
Right. Okay. Wow. I there's a lot of because I know somebody who inject what is it called again, doctor?
We call the dye.
The dye.
We call hysterossalpingography.
Right. And I've been told that like a lot of process for women is also really, really painful.
About 20% they got more painful, but 80% they said it's okay.
All right.
The feeling is about the periods come and got some pain.
So would you rather people who wants to start a family and who wants to have kids come for a consultation with you first if they really find difficult after maybe 6 months or 10 months?
Yes, and as I said, we start with blood tests and ultrasound first, but the tube, it will be later because I have to convince the husband to check the sperm test first.
So it's also both ways.
Sometimes it's more difficult than the test that I talk about.
Right. All right. Today we have a lot of information from the doctor today, but we will be going on air. No, well, online after this because I think medsters also do have questions that they want to ask you. So thank you so much, doctor, for going on air and sharing a lot of knowledge about infertility to medsters that are listening on air right now. But we will continue at the Facebook Live on air online.
Yeah, thanks for inviting me here.
Thank you so much. So for those of you who wants to know more about infertility, more depth, more infos, don't forget to watch the Facebook Live after this. Hello, swaddi to a healthier you. Bangkok Hospital is here. Everyone is unique and so is your health. Explore comprehensive healthcare services best suited for you and your lifestyle. Tailor your life and design your health at Bangkok Hospital, where advances in medicine meet with compassion ใครอยากฟังต่อนะคะสามารถติดตามได้ทางไลฟ์ใน Facebook ของเราทิ้งคำถามไว้ถามคุณหมอได้เลยตอนนี้ค่ะ
Met in Focus
โอเคค่ะคุณหมอสวัสดีค่ะ
ครับ
Okay, we're back with our Facebook Live. We are going to be talking more about infertility and how to overcome it. What would you suggest for medsters that are listening right now that are trying?
Start with I think that for the wife they should check they should record the periods. And then when I start taking care of my patient, we start with the history of her periods.
Oh.
And yes, it's quite important to tell many things about how effectiveness they try in the past. Because the one who has irregular menstruation, that means the ovulation time cannot be predicted. So that's the first step that I would like to know. And then for the blood test, normally we do the blood test today, 2 hours, the result come back, so we can talk about that. Go on. And the ultrasound right now is usually in my examination room, so just jump in and okay, and I give all information. So at just only the first time, everything will be done. But sometimes the husband, sometimes they come together, sometimes wife come early. So that's the point. When I ask them, okay, please check the semen analysis because the result of semen analysis can come back into two possibilities.
Right.
One, sometimes it's so bad until we cannot go on with natural way or IUI. So in this way, the wife has no need to check the fallopian tube at all because the sperm is not good enough for the natural conception. So that will help wife to reduce some kind of test.
Okay, so maybe start with the man
start
first.
With the yes.
So we start with the man first to lessen for women.
Yes, we start with the woman, but in the simple test. And then jump to the man. When we got information from the man, so we can go deeper into the detail of each couples.
Right. So when you say that when women who walks into the infertility clinic to see you, we need the record of our period. How many months back should we start tracking our period?
Around 3 to 4 months.
3 to 4 months.
Yes, and we need just raw data, like no need to explore or try to explain them. It's easy, like okay, how many days it's got and how many pads per day, something like that.
All right, so just simple log. Come in with a simple log for you, and that's basically it.
Yes.
So but I also I mean I have friends who are not living healthy lifestyle that finds it very difficult to have kids. But on the other hand, I do have friends who are very healthy lifestyle, but is having a difficulties in having kids.
Okay, I can give you some example that is the most important factors for the women. It's a two part. One is the age of the woman.
Right.
So they try to have a baby after 35 years old. That's a difficult time because after 37 years old, the egg number will run down really quickly.
Mm-hmm.
And also the quality of the eggs as well. And another most important part is about smoking.
Oh.
Because smoking will bring the number of the eggs down a lot. And normally it cannot bring back by like a vitamin or you change your lifestyle. So it's like when it's run down, it's already gone.
Oh.
So we have a lot of research about this, mostly in the European women. They smoke a lot and we found this problem a lot.
Right. Oh, I never knew that smoking, it really affects with the eggs. And I never knew that, of all the things that people promote, oh, eat this, take this vitamin, it's good for your eggs. So it actually has nothing to do with eggs. Once it's gone, it's gone.
Yes. And one more thing, the number of the eggs for each woman is not the same. But right now we have some kind of blood test and ultrasound to determine how many eggs you got and how much time you left for trying.
Oh, right.
So it's a much easier one. So for the one who just right now is not really marriage, but they have a plan maybe next 3 to 4, 5 years in the future,
Mm-hmm.
I recommend to come and do this test to see how much time you got left.
So คุณหมอคะ what would you suggest would be around the age that would be best to have a kid?
Right now it's quite difficult to say because anyway before 35 is very good. But right now the couples come to me, they say no, 35 is just a time that my job is still shooting up, so I don't have to time about this. How can I say? So in the we can meet in the middle, like we have to know that how many eggs
Okay.
she got
So
right now.
It doesn't matter what age you are, but come in, do the test so you know how much time you have left and how much eggs you have.
Yes, so it's like a tailor-made. So it's to be more flexible plan for each couples.
We have questions from our listeners. คุณเยาวลักษณ์นินิวสัมพันธชิต quite similar to what I've been asking you. She asks, I believe, maybe for herself, 38 years old, how many percent can I have a chance to get pregnant? 38.
So yes, so first of all, you have to understand that one month egg falling down one time.
Mm-hmm.
So I will tell the chance per 1 month. So if this month they try to have sexual relation on the time of ovulation, egg falling down, the chance is about 10 to 12% for 38 years old.
คุณเยาวลักษณ์คะ you have about 10 to how many percent? 12%.
10 to 12%,
10
but
to
1 month.
12%.
But anyway, next month she can try again, right?
Yeah, you can try 12 times a year.
Yes.
So don't give up. Don't give
after
up.
that, at 38 years old, when they tried about 6 to 8 months,
Right.
the percentage is not 10 to 12 anymore because the one who can get pregnant easily, they go first. So the leftover on that time, maybe only 3 to 5%.
All right. So that's when you come in to คุณหมอ to Dr.Papakorn to get tested on your eggs, your quality of eggs, and maybe freezing eggs. That it's a very common thing now amongst like teens, like maybe and older people to freeze eggs, right?
Yes. For example, for the one who they have like a boyfriend around 32 years old,
Mm-hmm.
but the test showed that she got less eggs than general population at her age.
Mm-hmm.
In this situation, they have a plan to have a baby maybe next 5 years, and on that time she may got the eggs like a 42 years old woman.
Oh, right.
So the freezing egg is a very good option on that time, right?
All right, another question from คุณอารวุฒิแสนสิริ Does any disease or most common disease that make female got infertility? Okay, let me rephrase this. What are
I understand. I think that most of the time, like we have the top three. The one is a ovulation problem, like they cannot got ovulation normally, and the second is about this they got the fibroid or chocolate cyst, like some problem with ovaries and the womb, and the third one is the fallopian tube blockage. So this is the top three of the problem.
Wow, I mean, there's so much going on for females. Like it's either you have those three problems, or if you do have eggs, but they're not your age, they're older, the quality is not good. So what would you suggest for females who has eggs, but the quality is not as great? Like let's say I'm 35. If I go check, maybe my egg is, let's say 42. Like how would you suggest that I do? What would you suggest that I do to improve the quality of my egg?
So it's like we talk about the time. If you are ready to have a baby right now, it is quite easy because 35 is not too much. But if you have a plan for 4 or 5 years later, we must use the quality of the eggs right now by freezing. And then after we thaw it out at 40 years old, for example, the quality of the egg is still 35 years old, for example. And if you don't use this method right now, and you wait until 40, 42 years old, we have to deal with the quality on that time, but we have some kind of technology to help. For example, we do IVF and we check the chromosome of the embryos before we putting back in.
Right.
So we have many options to help with good quality or bad quality, but each step they have their unique problem, and we have the way to solve it. So as I mentioned at the beginning, that it should be a tailor-made.
Right.
Like the couples come and talk, and I give the options 1, 2, 3, and which one that you prefer.
Right. So I've also seen the news of sometimes a woman who is maybe 60 years old is still capable in having a child. Is that because her quality of egg is not the same as her age? Or I mean, it's rare, but it's possible. I mean, how does that work?
Sometimes the chance may be less than 1%, but it's still yes. But anyway, 60, I'm not so sure because normally the women, they got menopause around 48 to 50 years old. And basically, about 2 years before menopause, the egg is usually not good enough to get pregnant.
So it's basically
sometimes
a
when
jackpot.
the women that older one, they use some donor eggs, I don't know.
But it's rarely anyone could get pregnant at that time. But if they do, it's like less than 1%.
Yes.
So you would suggest coming in to consult with you, and then maybe if you're not planning to have a children right now at this moment, freezing your eggs would be a great option too.
Yes, that's right.
And what about for men? Because we talk a lot about women. We want to know for men. What if, let's say the sperm count is not enough? So do they need to come in to collect sperm as well? Or how does it work for men?
Okay, this is my nowadays job. We usually talk about, okay, doctor, I take care of myself very well. I sleep well, I exercise well, I don't smoke. Everything is okay, so I don't have to check the sperm test, right? Because I have no problem. I said no, because sometimes all of this go to test the sperm, but they have no sperm at all.
Right.
Yeah, because sometimes some men they have a problem at born. The sperm production system cannot go on. So first of all, just test it, and then we advise the options of treatment later. For example, sometimes they smoke, they drink alcohol, but the sperm quality is so good.
Yeah.
So I said that I'll try to reduce it, but it's already okay. So no problem.
Doctor, we have another question coming in from Kun Prayurapat Kruer. The doctor mentioned about genetic testing to improve a chance of being pregnant. Can any couple get this test, or how high is the chance of pregnancy?
Okay, for Thai laws, they said they state that more than 35 years old women can do this test because in this group of patients they have to face about the Down syndrome baby, and that's an abnormal chromosome in the embryos. But anyway, not only the Down syndrome. When we do the test, we will know more that which embryo is better than another one. So that's mean we can select in the better way to reduce the time to pregnancy. Like if we have like 4 embryos, we don't know which one we put back in. But when we do the test, half of them will be eliminated because they have abnormal chromosome. So we pick up only 1 from 2 embryos. So you can see that we reduce the time to pregnancy. And for the women who more than 35 years old, that's a good candidate as well.
Right. So I hope today medsters know a lot more about how to overcome infertility and get to know more about infertility. But for those of you who are experiencing this problem, you don't forget that you can walk into Bangkok Hospital and consult with Dr.Papakorn, Mingmitpattanakul, for furthermore or whatever you need to check up. Today, thank you so much, Doctor. ขอบคุณมากๆนะคะ
Pleasure. Thank you so much.
ขอบคุณค่ะ So guys, for those of you who missed this live, you can go back and rewatch them since the beginning, because this is a very interesting topic that has been a hot topic amongst my friends right now who are having difficulties having kids as well. So don't forget, if you're experiencing this, consult specialists. All right, for you guys that have joined today, thank you so much for joining in, and don't forget, rewatch them since the beginning. But for now, hello, sawadee to a healthier you. Bangkok Hospital is here. Everyone is unique, and so is your health. Explore comprehensive healthcare services best suited for you and your lifestyle. Tailor your life and design your health at Bangkok Hospital, where advances in medicine meet with compassion. For now, I'm going to have to sign out. I hope you have a great day, and I'll see you next week. Let's see what we're going to be talking about with Bangkok Hospital. Bye.